Meno Warriors, it's Kate and welcome back to my channel where you can expect weekly videos from me to serve you where you are at in life. If it's the first time you've come across me, I help instill belief in you that you can be happier, you can be even more energized than you were in your pre-menopause years by following a simple strategy that I found a few years back. It's worked incredibly well for me. It's worked incredibly well for thousands, probably even millions of women around the globe. And I want to help share free tips and advice and strategies for you that might improve your life with the menopause as well. You can also find me on Instagram. I am at Kate Hartley UK. So head across there and I hope I can be of some assistance to you. So let's get started. So I think it's easy for menopause to have a really cumulatively negative impact on our life. Today I'm actually going to be talking about menopause and suicide in particular. Suicide actually is at the highest levels for women who are going through the sort of perimenopause, menopausal years. I think all the evidence out there points to the fact there's a really tight or very tight link with our hormones and unfortunately the elevated levels of suicide during that time. I talk to a lot of ladies who have been high achievers. They're having the corporate job, or they've had the corporate job. They're mums, they're very busy. They've technically had their life together before menopause hit. And since sort of perimenopause has arrived, they just feel like it's all falling apart, and it does have a snowball effect. It's not just one thing. It can be your sleep that's negatively affected. It can be hot flushes, which are just so debilitating that you literally are dripping in sweat, and also they make you feel awful. Some of them, they can make you feel really, really awful. It can be increased anxiety. It can be lack of libido and trying to make your partner understand that you just feel different about things these days. It can be all the other stresses of midlife, caring for elderly parents, being an empty nester when you've been you've been a full-on mum and your life is your kids are your life. And it can have so many different effects on us. And I think half of the problem is it's when menopause goes undiscovered or undiagnosed. Now, a lot of ladies go through perimenopause quite early. I went through it quite early, and perimenopause can last for a sort of period of 10 years. And when I went to the GP, I can't quite remember what the reason was why I went. I think I was just feeling like low, and I was prescribed antidepressants. I wasn't depressed. I just felt low. It would have been completely the wrong medication for me to have taken. I was listening to the story of this lady. She was 52, who was a high achiever. She was the working mum, the busy mum at home as well. Ticked all the sort of high achieving boxes. And she was menopausal. She was misdiagnosed. Well, they misdiagnosed her as clinically depressed. The problem is when you have a depressed mood with menopause, I think it's hard for healthcare providers to know, is it depression or is it low mood associated? Sorry, there's a little bit of an interruption there. So yeah, she was 52, high achiever. She was caring for an elderly parent. She was struggling with her sleep, getting all the sort of perimenopausal hot flushes, mood swings, low mood. She wasn't going out very much. She was waking up very, very early. She'd put on quite a lot of weight. So she actually ticked quite a lot of boxes for clinical depression, but it wasn't clinical depression. And she was put on antidepressants, but she didn't react well to them. So she was then given lithium, which sorry about my cat in the background. She also didn't react very well to that. And she was finally put on ketamine. She then saw a different GP, and there were all the sort of menopausal symptoms too, the lack of libido, discomfort when she was sitting down, the night sweats. And she ended up committing suicide. She did not recognize herself anymore. She withdrew socially, and she had got to the stage where her body didn't feel like her. She felt like she'd completely lost control of where she was at. She'd lost her anchor and she couldn't get it back. And she'd even seen a therapist because she felt suicidal. And then one day it just happened. But this story is not an isolated story. This story is similar across the board for women who are going through the menopause who end up committing suicide. And I mean, it's just such a tragedy for them, but also such a tragedy for the families that are left behind, because it's so frustrating when you think if she had not been misdiagnosed as clinically depressed, then maybe she would still be here. If she'd had the better treatment, if she'd had more appropriate treatment, and if she'd been able to understand that it was the menopause and that there were certain things that she could do to get her through that, then maybe she would still be here. And the problem is menopause symptoms are fairly similar to clinical depression when you're ticking them off, but there are differences too. And I think on the whole, our healthcare providers, our GPs, our doctors, they're in that profession because they want to do good, they want to help. But I think possibly maybe they need to be trained better. And I think nowadays, because we're talking so much more openly about menopause, I would imagine it's hopefully passing through that when a woman comes into a GP surgery, whether or not she falls into the category of the typical years of menopause, that, you know, if she's having night sweats, if she's got hot flushes, if she's having mood swings, if she's got vaginal dryness, if her libido's gone, and, you know, and a variety of other things, that they are thinking, this might be perimenopause. It could be early onset perimenopause. It might not be clinical depression, because it's also been proven that when menopausal low mood is treated with antidepressants, it's not effective. However, if a woman is given antidepressants along with HRT, then it is more effective. So it's really, really important to understand that it's not just about treating the depression per se. I mean, you know, the NICE guidelines, they should suggest 50% of the population will go through the menopause if we live that long. And the other 50% have got to deal with the fact that the women are going through the menopause. And it does happen to women under the age of 40 a lot. When I went in, I think I was through with the menopause by 46. And I started with symptoms probably about 34. I can't quite remember. But my perimenopause, I didn't even know it was perimenopause. My symptoms went on. I had them for quite a long time. My night sweats were the worst thing. I would be absolutely drenched at night. And then hot flushes hit me really, really hard after that. But 47 million women reach the menopause every year. 25% will suffer severe problems with it. 77% don't even realize their symptoms are menopause related. And 79% had visited their GP about their symptoms. And 7% of those had to see their GP at least 10 times for adequate help or advice. That's pretty scary, isn't it? And 12% had to wait more than 5 years to get on the appropriate treatment. So this shows that suffering is going on, because estrogen affects literally every single cell of our body, and it can have a huge, huge, huge implication on it. And obviously psychological symptoms are very, very serious. Perimenopause depression is partly because our hormones don't decline gradually. They're really, really erratic, they're very chaotic, and they can cause a lot of instability in how our brain works. And it's a 16-fold increase in depression in women aged between 45 and 52. So there has to be some hormonal influence in this, and a 7-fold increase in suicide in women aged 40 to 50. And perimenopausal women are 7 times more likely to have suicide ideation. That's a pretty scary statistic. It's hard to actually diagnose whether you're in the menopause is really tough, because you can't really have a blood test, because particularly perimenopausal, the the hormones are up and down and up and down and up and down. So they might be up at one point, but they might be down at another. So it's a very difficult thing to actually diagnose from a blood test. However, there was a study that surveyed an enormous amount of women who are perimenopausal and menopausal, and the mental health of those women improved by, I don't know how they measure it, but it says 62% when they felt that they had the tools to diagnose menopause themselves or their perimenopause themselves. So the more we can be talking about this, the more we can be sharing what the common symptoms are about menopause, the more the likelihood is that women are going to be able to self-diagnose. And like I said, I mean, it does, the evidence points to the fact that antidepressants by themselves are not sufficient in order to alleviate the mood swings and the depression and the anxiety that can come with perimenopause or menopause. But when linked with HRT, with an adequate and appropriate course of HRT therapy, they can be more effective. And I think a lot of women still aren't listened to. You know, in the workplace, there was this story that I heard about somebody who is a teacher who was menopausal and brought it up with, I don't know, the head teacher, whoever was, you know, in charge at that school. And she was told that, no, that's absolutely fine. Don't worry, we'll make special dispensation for you. You can just sit next to an open window. And that was a special dispensation. It's just like, it's just ridiculous. And it is so hard, you know, when you think if you're a high performing or anyone at work who has any sort of sense of responsibility or ownership of their job, they just enjoy it, and they you know, they don't want to lose their job, but they know they've got perimenopause, they've got the brain fog coming on, they've got the hot flushes, which can be incredibly embarrassing, particularly if you literally drip with them. You know, if you have to wear a blouse for work, you don't want to be walking around with it all sweaty and stuff. And it can be really debilitating, the anxiety that can creep up. And you know, if you've got like brain fog, I remember when I was perimenopausal, I mean, I have made a few changes that have helped my brain fog a lot, but there are still days when I forget words and I forget what I'm saying, and it's just like, I suppose I've just accepted is where I am in life. I can't change it. I've made improvements to make it a lot better. And I do make sure I prioritize my sleep, which incidentally has a big impact on your brain fog. But I'm still not as sharp and as organized as I used to be. Whether I ever get that back, I'm not entirely sure. But it's, you know, when you're trying to function fast, you're trying to do it all. And then you're beating yourself up because you can't do it all, but you're afraid to actually tell your employer that you're struggling. What, you know, we're all, if I was in that position, it's just like, well, I hadn't better, because they might fire me for not being able to do my job properly. And you can understand why so many women are struggling and suffering in the workplace. Also, another interesting fact is 66% of women have mistakenly been given antidepressants, and they've also been very often given a multitude of different antidepressants. So when one lot hasn't worked, they just bung them on something else which might be stronger, bung them on something else which might be stronger, and of course you've got all the side effects related to those as well. So you know, this isn't anti the doctors. I really want to stress that I think doctors do an amazing job. I just think perhaps training needs to be different and more menopause focused. During Mental Health Awareness Week, you know, there were stories about people going into like doctor's surgeries, and there was nothing about, not even like one of those flipboard things with any reference to Mental Health Awareness Week. It has to be, we have to be talking about this much more often. I don't think it's anybody's fault. I don't know. I don't really like playing the blame game. I think we all have a role to play, but I think perhaps education could be better for doctors. Perhaps they should be allowed a little bit longer to talk, if that's at all possible, to women when they come in with menopausal symptoms. You know, for 10 minutes, when you have that 7 to 10 minutes in the doctor's surgery and you are ticking a lot of the boxes of clinical depression, but it's not depression, it's menopause. How do they manage that? I think also I honestly and truly, I do think this, and I'm not anti-men at all. There are some amazing men out there. But I think if it was a man, we still live in a fairly patriarchal society. And if you told a man that, well, this is definitely 100% sure you're going to go through this in your life, it's going to affect you, it's going to last forever, you're going to feel really awful, your memory is going to be impacted, you probably won't be able to work very well, you're going to feel irritable, you're probably going to get night sweats, you're going to have hot flushes which are embarrassing at work because you're going to look all sweaty and you're going to go all flushed, you're probably going to have headaches, you're probably going to have joint pain, you're probably going to have muscle stiffness, you probably won't feel like sex, and if you do, it's really going to be painful. How do you think that would go down? I think policy would have changed years ago if that were the case. A lot needs to change. We need to recognize mental health needs. We need to be recognizing postnatal depression more quickly, because if you've had postnatal depression, there's a higher incidence that you're going to struggle with anxiety and mood disorders and possible depression through menopause. So keep talking about it. And if you really, if you're seeing your doctor and you feel you've got that inkling that it's not just depression, it's depression, you've got depressive feelings linked to fluctuating hormones. If you self-advocate, have a look at the menopausal symptoms, see, have you got the hot flushes? And you don't have to have them all, but have you got some of them? Have you got inner mouth sensitivity? Have you got joint stiffness? Have you got mood swings? Are you more irritable? Do you have sudden anger bursting up inside? Have you got the brain fog? I'm trying to think of the others sort of off the top of my head. I mean, there are so many symptoms. Do you have like the burning sensation in your mouth? Have you got dry eyes? Are your mucous membranes dry? Has sex suddenly become painful? Are your mucous membranes not as lubricated as they used to be? Are you having anxiety suddenly creeping up upon you? All these things could well be signs that you're perimenopausal. So if you believe that and you're struggling with low mood or depressive feelings or indeed suicidal ideation, go and see your doctor. Do not delay. Go and see them, but also explain that you think you're possibly perimenopausal or going through the menopause, and bring it up with them. And if you're not satisfied with the treatment that you've got and the way you've been handled, go back and see another one. Like I said, some of those people had to go back numerous times. Some of those women had to go back numerous times before they had the correct treatment that they needed. So own it. Don't feel you're being a pest. There are times when we really do have to put our lead-lined boots on and stand there until somebody gives us the stuff that we need. But I do also think there, when we can advocate for ourselves, when we can inform ourselves on perimenopause, menopause in general, it just helps sets us up for successful treatment. So I really appreciate you hanging on in there with me. Thank you for your company. Just if you're having those thoughts, talk to somebody, and also suggest, if you're watching this, that you're obviously thinking you're menopausal, you're perimenopausal, or you know somebody who is, go and see your doctor, make them listen to you, and know that there is light at the end of the tunnel. So thank you for your company, and I will catch you again soon.